Are you living with chronic pain? Have you been struggling with debilitation? Have you been managing these conditions instead of healing them? Here's the truth. You're not healing. You're maintaining the same damage. Actually, if you're like millions of people who are suffering from chronic degeneration, you are not only not getting better, you're probably getting worse. And if that hits a nerve, it should. Because think about it. How many times have you been told, let's try this steroid injection. Let's give it more time. Take this medication for pain or go to physical therapy. And for a moment, it may seem to work. The pain reduces, movement improves, and you think, finally. And then it happens. It comes back. You have the same pain and limitations, maybe even worse. And at some point, you have to ask a hard question. Is this treatment actually improving my issue, or is this simply suppressing symptoms or worse? Because these are not the same thing. Real treatment repairs. Maintenance keeps you functional just enough to tolerate the problem. And most people don't realize you've been stuck in maintenance for years. Let me say something clearly that most people never hear. If your condition keeps coming back, it's not because your body can't heal. It's because nothing you've done has actually repaired the tissue. That's it. It's not age, bad luck, or genetics. It's a repair problem. Stay with me because what you're about to see will challenge almost everything you've been told about healing. By the end, you'll understand why traditional orthopedic care creates dependency instead of resolution. Why your body hasn't failed you, it's under-equipped. The exact difference between symptom suppression and biological repair. How regenerative medicine actually works beneath the surface. Why most regenerative treatments fail and how to avoid that. And how a fully controlled in-home medical system changes the outcomes entirely. And then you can make an informed decision. A decision not based on hope, but on clarity. Pain is not random. Pain is information. It's your body saying something is damaged, something is not being repaired, something is breaking down faster than it's rebuilding. And if that signal stays on, it means that the repair process has failed, not paused, failed. Because real healing doesn't come and go, it restores. Now, before we go any further, you need to understand who's actually behind this. Because what I'm about to walk you through only matters if you trust the source. My name is Dr. Divingian. Most people know me as Dr. D. I'm a physician with a background in emergency medicine and internal medicine, which means I've spent years in environments where decisions matter fast and outcomes matter even more. I've seen what happens when things go right. I've seen over and over again what happens when they don't. Unfortunately, the same holds true for most conventional treatments for chronic pain. Here's what that experience makes very clear. The traditional medical system is not built to fix dysfunction. It's built to stabilize problems, to manage symptoms. True healing is never part of the plan. When it comes to chronic joint pain, soft tissue injuries, and degeneration, that gap becomes painfully obvious. You may be wondering why all the drugs your doctor has given you never seem to resolve the problem. There's a valid reason for this, and it's critical you hear this. Conventional painkillers and anti-inflammatory drugs actually make the problem worse. That's correct, you heard that right. As a licensed physician, as an MD, I'm telling you the facts. As examples, both steroids and NSAIDs, non-steroidal anti-inflammatory drugs, are now confirmed to impair regeneration. That's right, steroid shots and NSAIDs cause harm to the very tissues that they're intended to help. Emerging studies have repeatedly demonstrated that these drugs disrupt collagen synthesis and fibroblast functions, both critical for regeneration. In fact, the science proves that the long-term use of these drugs actually lead to weaker tendons and ligaments and cartilage degeneration. That means your so-called treatments are doing little more than suppressing pain while simultaneously harming the very tissues you're trying to heal. It's not just something that I've seen clinically. It's something I've personally experienced. I've dealt with injuries. I've punished my body during military service and all the times I pushed the envelope as an athlete. And like you, I've been on the receiving end of the same flawed system where the usual options were presented to me: medications, temporary interventions like steroid shots, and physical therapy, or eventually surgery. And at some point you realize you're not being guided towards repair. You're being guided towards tolerance. And I wasn't willing to accept that. Now let me show you the moment everything changed for me. Because for some of us, there's always a moment when you stop following the system and you start questioning it. I remember a patient who came in with chronic knee pain. This had been going on for years. They had done everything their doctor told them to do. And for a while, each treatment helped a little, temporarily. But the pain and limitations never went away. I remember looking at their chart and seeing at the pattern and realizing something that honestly should have been obvious much sooner. Nothing we had done was actually designed to repair the tissue. Not one intervention. Everything was designed to mask the symptoms, hide the pain, improve function just enough, but not fix the underlying damage. And the day would come that I could no longer give yet another injection to hide the problem. That's when it hit me. We weren't treating the problem. We were managing the symptoms of the problem, masking the underlying degeneration over and over again, until the patient accepts that this is the way it has to be. And then they accept that what they love to do can no longer be a part of their lives. They form a belief that says, I can no longer lift weights. How many times have I overheard this in the gym? Or, I can't pick my grandkid up anymore. Or you might be wondering, can I no longer golf? Or, can I no longer use the stairs? And you're not alone. The Institute of Healthcare Policy estimated that 70% of adults over age 50, 70% experience joint pain. Instead of enjoying the best years of your life, you may be dealing with the most painful, just treading water, but not savoring those moments in your life that you work so hard to attain. Modern medicine is like this. Imagine the oil light that pops on in your car, but instead of fixing the issue, you disconnect the light. The warning goes away, but the damage continues. And that's what most treatments are doing. They turn off the signal, but leave the problem untouched. And when this happens, you get worse. The fact is, you never treated the real problem in the first place. So the real question isn't, how do we reduce pain? The real question is, how do we repair the tissue, treat the root cause so that pain is no longer a problem? That's a completely different objective, and it requires a completely different approach. If you think about your own situation, you probably experience the same thing. Something works until it doesn't. You feel better until you don't. And then you're right back to where you started. It's a broken model that you're part of. So once that became clear, everything changes. Because now the focus isn't about managing symptoms. It's about restoring function at the source. That's what led us to build a completely different way of practicing medicine. It's not another steroid shot or lidocaine patch. Not another prescription of Celebrex or meloxicam, which can eat out your stomach lining. And certainly not more ibuprofen. All that's like spitting in the wind. Instead, we created a clinical practice designed to actually work with the natural processes to heal our patients and to reduce your dependency on the medical system. But more than that, we created a concept, a system, one that exemplifies our ethos to rise above your limitations and restore the part of you, the real you, that's been held down for far too long. The system is Operation Phoenix. Operation Phoenix introduces a completely different model of care, one built around a simple question. What would it look like if we actually prioritized repair? Not just reducing pain, delaying progression, or merely masking symptoms, but restoring function at the target level where the damage has gone unresolved. Let's be honest about where you are. You've already tried things. You did everything your doctor wanted you to. You followed instructions, you gave it time, and yet you're still dealing with it. And if anything, the pain, the stiffness, and the limitations keep getting worse. That's not lack of effort. That's a defective treatment plan. Now let's flip it. Imagine waking up and the first thing you don't think about is your pain. No stiffness, or how bad is it today? You no longer need to adjust your day around limitation. You move without negotiating with your body. You train, you golf, you play with your grandkids, you travel, you live without planning around discomfort. That version of you isn't hypothetical. That version exists when repair actually happens. Healing happens when three things align: biology, environment, and execution. You miss just one of these, you stall. You miss two, you fail. Let's go deeper. Your body already has a repair system. That's not the issue. The issue is this: your body doesn't have enough resources to execute the repair. Think about a construction site. If you have too few workers, poor communication, limited materials, the project drags on or never finishes, and eventually the structure breaks down. That's not theory. That's exactly what's happening inside your body right now. So the real question isn't, why are you not healing? It's, what's missing from the healing process? Because once you fix that, everything changes. And that brings us to the first shift, one that actually makes repair possible in the first place. Stay to the end of this video so you can learn the 3 strategies that must be in place for you to actually heal and experience relief from your pain. In order to understand how effective and life-changing stem cells are as a regenerative treatment, it really helps to have a basic understanding of what makes them so different. Stem cells are not like other cells that are limited to a specific specialized role. Stem cells are functionally blank cells with no specialized role until they're needed. Once they're needed, stem cells have 2 absolutely incredible capabilities that can help heal injuries like yours. Stem cells can transform into different types of cells, which is important for different types of tissue repair. They can also replicate themselves, which transforms these stem cells into an army for areas of the body that need more raw material. On top of all this, stem cells also reduce inflammation, stimulate collagen production, recruit your body's own repair cells, and then help reset the biological surroundings of that tissue. In short, the stem cells can be considered your body's greatest repair mechanism. But here's the part that most people never hear. Your body doesn't lack the ability to heal. It lacks inventory. You simply don't have enough stem cells where you need them. So your body defaults to scar tissue or incomplete repair, chronic inflammation, or ongoing dysfunction. And over time, that becomes pain, loss of mobility, and structural breakdown. Your body triages. It saves the limited stem cells for major emergencies. Certainly not your knee, your back, or your shoulder. So it gives you that fast patch job instead of a full rebuild. And that's why it's necessary to obtain the right dose and concentration of stem cells to trigger the healing response. Strategy number 2, stem cells do not act alone. Once activated, stem cells deliver a payload of regenerative components your body needs. One of these essential factors is known as exosomes. Exosomes are nano-sized vesicles that possess a number of important functions. Chief among these are their biological toolkits. These toolkits come in the form of growth factors, proteins, and genetic material essential for repair. Not only that, exosomes are the stem cell signaling molecules that play a significant role in activating the repair mechanisms. They also provide the genetic blueprint needed to generate the healing process. So not only do exosomes bring the biological supplies needed for tissue reconstruction, they also start the entire process and they bring the instructions needed to get the job done. Exosomes also have an added bonus. They regulate inflammation. Simply put, Exosomes don't just support healing, they orchestrate it, accelerate it. Now this is where everything shifts. Most clinics use one or the other. We don't. We combine them. Not just the exosomes that were produced by the stem cells, we include additional exosomes to magnify their effects. Together, the stem cells and extra exosomes become a potent mix. You get what in military terms is called a force multiplier. Now that you have a basic understanding of stem cells and exosomes, as well as how much more effective they can be when combined, there's one more very important fact you need to know. That's the type of stem cells that work best. This is very important because you don't want to waste your money on the less than ideal stem cells. Let's briefly explain which stem cells are not the best choice and why. We're talking about your stem cells. These are either fat-derived stem cells or bone marrow-derived stem cells. Simply put, these stem cells exist in your fat and bones. And the reason why your stem cells from either your fat or bone are not ideal is because, how should I put this delicately? You're more seasoned individual. You're old, but in a good way, like fine wine. But guess what types of stem cells are used by most clinics? You got it. Now, don't get me wrong. If these stem cells were worthless, no one would be using them. They do offer benefits that are much better than conventional treatments. But depending on the age of the individual, whether this person smokes, if there are any diseases or health conditions, how much exposure to inflammation the body's had, and how much wear and tear and cellular damage that person has accumulated over the years, will determine how robust these stem cells are. But even the fittest, most health-conscious person you know still has aged cells, nothing like when they were born. So these fat and bone marrow-derived stem cells can only take regeneration so far. Here's the good news. There is a type of stem cell that is derived from the perfect source that is free of illness, disease, inflammation, and age. And it comes from a healthy tissue that's normally discarded every time a mother gives birth to a healthy infant. I'm talking about a unique substance found in the umbilical cord known as Wharton's jelly. Wharton's jelly-derived stem cells are biologically age 0, which means they've never been exposed to the abuses of daily adult life. They have stronger regenerative capabilities than adult cells. Wharton's jelly stem cells also have natural anti-rejection properties so that they can be safely accepted by the body. In short, Wharton's jelly-derived stem cells are the best of the best of the best. And that is the only kind we use for our patients. But the advantages of Wharton's jelly extend beyond the stem cells. This is also the same source we obtain exosomes from. That's right, Wharton's jelly contains its own rich supply of exosomes. So not only will these stem cells be among the best stem cells available, they'll also have among the best exosomes available. But the benefits of Wharton's jelly just don't end with stem cells and exosomes. In fact, even without the stem cells, the other nutrients within Wharton's jelly have so many regenerative components, they have the ability to provide incredible healing on their own. This powerful substance contains additional growth factors, collagen, and something known as the extracellular matrix. The extracellular matrix provides the scaffolding or framework needed to facilitate the building of the tissue's new structure. This is incredibly important for the regenerative process. Simply put, the combination of Wharton's jelly, its stem cells, its exosomes, the growth factors, the collagen, and the extracellular matrix make this treatment a regenerative powerhouse. The third strategy is how the treatment is delivered. This isn't complicated. This is about pressing the easy button. Treatment is delivered through targeted injections, IV infusion, or both, done on the same day. No drawn-out process. 1 to 3 visits depending on the severity of the injured tissue. And then the biology takes over. And when it comes to where you need the treatments, you will receive ultrasound-guided injections, meaning every administration of stem cells are precisely delivered where the exact damage lies. No guesswork, only precision. Let's set this straight. This is not overnight magic. This is real regeneration. So here's the timeline. The first noticeable changes occur in 3 to 4 weeks. Major improvement is seen in 60 to 90 days, and continued healing up to 6 months and beyond, because rebuilding tissue takes time. But it's the first time in a long time that the regenerative process is actually happening. Now you realize you have a shift. You can keep suppressing symptoms, keep cycling through temporary fixes, keep watching the condition slowly worsen. Or you can finally give your body the building blocks, the communication, the true healing it's been missing this entire time. Healing is not left to chance. It's engineered through correct inputs, aligned systems, sustained support, because the body does not respond to intention. It responds to conditions. Now, here's the piece most people completely underestimate. Execution refined into experience. Not just whether the treatment is done, but how it's delivered. You can have the most advanced biologics, a perfectly designed protocol, a system built for results, and still fall short because the delivery breaks down. And when the delivery breaks down, the outcomes follow. Most people assume results come from the treatment alone. They don't. They come from consistency, precision, follow-through, and environment. This is where traditional care collapses. Traditional care is built for volume, not outcomes. It's like this. You wait, you get rushed, you get a partial attention, you leave with fragmented instructions, and then what? Follow-ups delayed or non-existent, communication is inconsistent, adjustments happen too late. Everything becomes reactive. Healing becomes disjointed, incomplete, unpredictable. Momentum gets lost between visits. And once momentum's lost, progress slows or stops entirely. Now flip the model. Everything is built around you, not the clinic, not the schedule, not the system, you. Care is delivered in your environment, your home, on your timeline, with full control over the variables that matter to you. No waiting rooms, no interruptions, no competing priorities. This is not only convenience, this is maximum customization for maximum results. White glove service is not a luxury add-on. It is a structural advantage. It means dedicated, uninterrupted provider attention, controlled treatment conditions, seamless coordination before, during, and after care, immediate response to changes in your condition. Nothing is left to chance. Every step is intentional. Every detail is accounted for. Healing doesn't happen in isolated moments. It happens in continuity. That means pre-treatment preparation is aligned, treatment delivery is precise, post-treatment follow-up is customized and structured. There are no gaps, no drop-offs, and no guessing. Because even the best treatment fails without continuity. This is not a solo effort. This is a coordinated medical operation. Every patient is supported by medical providers that are trained in regenerative therapies who deliver service in your home, a clinical staff that ensures precision and execution, and a system that tracks progress, responses, and adjustments in real time. So each role has one objective: protect the outcome, your regenerative outcome. Because healing is not a single decision. It is a sequence of correctly executed steps. Traditional care starts when you walk through the door. Everything happens live. Your history is reviewed, your case is interpreted, decisions are made on the spot, and that's reactive. This model operates differently. By the time care is delivered, your case has already been reviewed in depth. Your history has already been analyzed. A plan has already been structured. You're not starting from zero. You are stepping into a system that is already in motion. When you combine the controlled environment of your home, compassionate oversight, and coordinated execution, you eliminate the variables that destroy results. Healing becomes more predictable, more stable, and more complete, not dependent on chance. True regeneration is reliant on a system that's designed to work. This is the difference between receiving treatment and being guided through a fully controlled recovery process. Because at the highest level, it's not just about what is done. It's about how it's done, when it's done, and what happens after. That is what white glove service delivers. And that's what turns possibilities into results. Let's confront your default beliefs. I've learned to live with it. Surgery is my only option. It's too late. These statements are what people believe when they've run out of options. You haven't. Let me ask you something. If nothing changes, where will you be in 2 years? In 5? More restriction, more compensation, degeneration? This isn't about being dramatic. That is the possible trajectory. Now flip it. If the problem is actually repaired, what comes back? Movement, strength, confidence, and freedom. That's what's on the other side of real healing. So let's look again at your current reality. You've tried the medications, the therapy, the injections. You've waited, hoped, and adapted, and still you're here. So the real question becomes, do you maintain the status quo or do you change the system? So you have 2 paths. With path 1, you stay where you are. You manage the symptoms, accept limitation. With path 2, you repair the damage, restore function, and take control. If this actually works the way it's designed to, and you restore function in your knee or your back or your shoulder, what does that give you back? Mobility, freedom, independence? Because that's what it's really about, not the joint, your life on the other side of it. So here's what happens next. We look at your case. We determine if it's the right fit. If it is, we build your plan, and then we execute it with you. This isn't just about suppressing symptoms. This is about finally doing what actually works, what actually heals. Pain is not your problem, it's a symptom. Unrepaired damage is the real problem. And now you have access to a system built to fix it. Click below. Schedule your complimentary consultation. Let's find out what's actually wrong, what's actually possible, and what your next move should be. Stop negotiating with your limitations and adapting your life around a problem that hasn't been solved. Instead of accepting limitation and pain, it's time for something new, something that finally gets the job done. Take that next step and contact us at Operation Phoenix now.